Welcome. You are listening to IJD in Focus, the monthly podcast series of the International Journal of Dermatology, featuring the latest editors' highlights and a summary of our open access publications available to everyone.
The classification of skin types based on color or categorization by race, ethnicity, or geographic origin still lacks a universally accepted framework. The definition of skin of color, SOC, is also imprecise and is often used simply to denote individuals who are not of Caucasian White origin. Beyond pigmentation differences, several diseases show distinct biological behavior and clinical presentation in more pigmented skin. The January issue of the journal reviews alternative approaches to skin type classification and addresses long-standing biases in training, research representation, and clinical resources. South African experts contribute with population-specific photoprotection guidance that considers ultraviolet, visible light, and socioeconomic factors. A systematic review of hair and scalp disorders further underscores the high rate of misdiagnosis in SOC patients due to atypical presentations and limited training. These data indicate an urgent need to strengthen dermatologic expertise regarding SOC patients.
A Viewpoint article by Bellomo et al. Critically revisits the growing role of genomic testing in melanoma care. It challenges a study by Prieto et al. That compared two genetic tests, CpG-EP/Merlin and 31G-EP, for identifying melanoma patients at low risk for lymph node metastasis who could potentially avoid sentinel lymph node biopsy. The authors highlight substantial methodological limitations, including selective focus on false emission rate, while ignoring other critical metrics and incomparable cohorts with different inclusion criteria that skew the original results in favor of 31GEP. Through a reanalysis using harmonized cohorts, Bellomo et al. Demonstrate that CpG actually outperforms 31GEP by classifying substantially more patients as low risk, 37% versus 31%. 4.9% while maintaining lower rates of missed node-positive cases across all prevalence levels, underscoring its greater clinical utility in reducing unnecessary surgical procedures.
Shifting from molecular diagnostics to clinical reasoning, a clinicopathologic challenge by Fernandez-Martinez et al. Presents a progressively enlarging hardened skin plaque. Stiff skin syndrome, SSS, is a rare connective tissue disease manifesting as a progressive, non-inflammatory fibrosis that causes the skin and soft tissues to harden. It can result in restricted joint movement, particularly affecting the shoulder and pelvic girdle. A segmental variant, associated with a more favorable prognosis, further complicates recognition. Due to its similarity in presentation to other scleroderma-like conditions, this case-based diagnostic challenge emphasizes
the issue of equity in dermatologic care is addressed comprehensively in a two-part review by Henry W. Lim et al. The first part presents an international expert consensus on defining skin of color and delivering equitable dermatologic care. Dermatological practice faces significant challenges in meeting the needs of populations with skin of color, SOC. Patients with SOC face disparities, including misdiagnoses and inequitable treatment outcomes. This expert consensus sought to identify gaps in dermatologic care for these populations and to propose strategies to promote inclusivity. Classification systems for SOC and healthcare disparities were investigated by reviewing English language articles on the subject published in PubMed between 2019 and 2024. An international panel of multidisciplinary experts from 4 continents, America, Asia, Africa, and Europe, analyzed the findings and developed recommendations. There are limitations in the current skin type classification systems, and gaps persist for SOC populations in research, clinical trials, and education for both providers and patients. Proposed strategies to bridge these gaps include refining classification systems, dermatology societies, advancing SOC-specific research, enhancing education, and integrating artificial intelligence. Key recommendations from the panel focused on 4 areas. 1. Research. Achieve SOC numbers in clinical trials and publications that would be a reflection of local and global populations. Publish new guidelines on key SOC-related issues and achieve representative authorship in the said clinical trials and publications. 2. Resources. Create a global library of SOC images for dermatological diseases. 3. Education. Provide training for healthcare professionals and scholarships for students worldwide to improve awareness and expertise. 4. Representation. Ensure SOC representation in images used for patient communication and educational materials.
The second part of the review by Lim et al. Turns from definitions to practical implications, focusing on knowledge gaps in care for dermatologic disorders in skin of color. Patients with skin of color, SOC, face unique dermatologic challenges that are often underrepresented in research and in dermatological education, creating critical gaps in care. We aim to identify and explore key gaps in research and clinical management for SOC across 4 domains: skin diseases, hair disorders, photoprotection, and aesthetic procedures. An international panel reviewed articles retrieved from PubMed using the search terms skin of color or skin of color in titles and abstracts from September 2019 to September 2024. Inflammatory skin diseases, including acne, atopic dermatitis, psoriasis, and rosacea, are common in SOC subjects, necessitating tailored diagnostic and therapeutic approaches due to unique clinical presentations and specific challenges such as post-inflammatory hyperpigmentation and erythema detection. Pigmentary disorders such as melasma and acne-induced hyperpigmentation significantly impact quality of life in SOC, requiring cautious treatment to avoid exacerbation, while the unregulated use of skin bleaching agents containing high-potency corticosteroids can pose serious health risks. Skin cancer in SOC often presents at advanced stages with poorer outcomes due to lower awareness and unique clinical manifestations, resulting in delayed diagnosis. Hair disorders in SOC populations require tailored diagnostic and therapeutic approaches due to unique hair properties. Gaps in photoprotection education on SOC exacerbate pigmentary disorders and other dermatologic conditions, with limited research on effective sunscreens for this population. In aesthetic dermatology, misconceptions and knowledge gaps regarding the prevention of complications hinder access to safe and effective procedures for SOC subjects, compounded by inadequate diversity in clinical trials. Inclusive research, improved diagnostic accuracy, and customized procedures are needed to ensure equitable dermatologic care.
Translating the principles of tailored diagnostic approaches and culturally informed patient education into region-specific guidance, an original review by Isaacs et al. Offers sun protection advice for the South African population for the prevention and management of skin diseases. Sun protection is critical for the prevention and management of skin cancer and other photosensitive dermatoses in South Africa's diverse population. This article expands traditional photoprotection guidance by addressing condition-specific needs, incorporating advances in sunscreen technology that improve protection against UVA1, visible light, and infrared radiation. Particular emphasis is placed on tinted sunscreens for pigmentary disorders and practical sun avoidance strategies in resource-limited settings, reinforcing the importance of context-sensitive prevention.
From prevention to diagnostic precision, another original article by Ricken et al. Addresses the question, what is the diagnostic capacity of existing severity scoring tools for nail psoriasis? It is challenging to distinguish nail psoriasis, NP, from nonspecific nail changes, contributing to heterogeneity in clinical trials. In this cohort study, psoriasis patients and matched controls were assessed using NAPSI and N-nail scoring systems. By defining optimal cutoff values through ROC analysis, the authors demonstrate that both tools can aid not only in severity assessment, but also in diagnosis, with N-nail showing superior accuracy. These findings support its use for improving diagnostic consistency and trial inclusion criteria.
Continuing with regionally informed care, a Middle East-North Africa consensus paper by Zimo et al. Describes the use of dermacosmetics in acne management. Acne in the MENA region is frequently complicated by post-inflammatory hyperpigmentation and scarring. Through a Delphi-based consensus process, regional experts recommend dermacosmetics as both monotherapy for mild acne and adjunctive therapy to improve tolerability, adherence, and outcomes. The paper reinforces the foundational role of cleansers, moisturizers, and photoprotection in comprehensive acne care.
Medication safety remains a recurring theme, addressed in a pharmacovigilance study by Gupta et al. Using data from the FDA Adverse Event Reporting System, the authors examined post-finasteride syndrome-like adverse events in relation to route of administration. Their analysis revealed fewer safety signals associated with topical finasteride compared with oral formulations, while highlighting the influence of confounding factors such as age, stress, and comorbidities. The findings urge caution in attributing causality and call for more robust, controlled studies.
Addressing Therapeutic Equity in Alopecia, a retrospective case series by Mukenge et al. Evaluated JAK inhibitor treatment outcomes in Black patients with alopecia areata. Despite historical underrepresentation in trials, most patients experience clinical improvement with meaningful reductions in SALT scores. Improved access through insurance and assistance programs further underscores the importance of inclusive real-world data.
Safety considerations for JAK inhibitors extend beyond alopecia, as shown in a real-world cohort study by Zhao et al. In atopic dermatitis. By comparing JAK inhibitors with IL-4/IL-13 inhibitors, the authors found no increased cardiovascular or cancer risk, providing reassurance while emphasizing the need for continued pharmacovigilance.
Autoimmune overlap is explored in a nationwide case control study by Wohl et al. Analyzing over 33,000 alopecia areata patients, the study confirms a significantly increased prevalence of systemic lupus erythematosus, particularly in children. These findings highlight the need for vigilant screening and support the rationale for shared targeted therapies.
Finally, diagnostic equity comes full circle in a systematic review by McMullen et al., examining misdiagnosed hair and scalp conditions in SOC patients. High misdiagnosis rates, sometimes with severe consequences, were linked to atypical presentations and limited training exposure. The review emphasizes the value of scalp biopsy and the urgent need for improved SOC-focused education to reduce diagnostic error and improve patient outcomes.
This concludes our January 2026 episode of IJD in Focus. Happy New Year. Thank you for listening. Until next time.